Hey guys, welcome back to my YouTube channel. My name is Shiny and I am a third year dental student. In today's video, I'm going to be telling you everything that you need to know about BDS. If you are someone who wants to join BDS after your NEET exam or who's planning to join BDS but wants to know more about it, this video is for you. I'll be telling you everything that you need to know about BDS, right from the introduction of the course, what you do in every year, the duration of the course, the eligibility criteria to join BDS, the fee structure, how to choose the right college, how to know if this is the right course for you, scope and option after dentistry. BDS, Bachelor of Dental Surgery, is the only recognized and approved course in India to practice dentistry. Dentistry is not just about 32 teeth, guys. It's much more than that. There are 9 various specialities in dentistry. So moving on to the duration of the course is for 5 years, first 4 years of academics and the last year of internship. The eligibility criteria to join the course is you should have passed your 12th grade examination with a minimum of 50% marks in physics, chemistry and biology, and obviously you should have cleared your NEET exam. Now moving on to the fee structure, there are 4 types of BDS seats available in India. Government college, you can get into a government college, or you can get into a self-financing college through government quota, or you can get into a self-financing college through management quota, or you can get into a deemed university. If you join a government college, the fee structure will range anywhere between 50,000 to 1,50,000 per annum. And if you get into a self-financing college through government quota, you will have to pay anywhere between 3.5 to 6 lakhs. And if you get into a self-financing college through management quota or a deemed university, you will have to pay anywhere between 7 to 10 lakhs. Remember, this is just an approximate amount and it is not going to be the same everywhere. Fee structure will keep changing. This is just an approximate amount to give you an idea. Now, moving on to what we do in each year. As I told you, the duration of the course is for 5 years. The first 4 years is purely academics and the last year is for internship. Internship is where you will have to work at the hospital that is attached to your college. And now moving on to the first 4 years, the first 2 years are known as the preclinical year. The third year and final year is known as the clinical years. BDS is the only course where you are allowed to work on patients right from your third year. You will have clinical postings right from your third year and you start working on patients. The first 2 years are known as the preclinical year where you get trained on how to work on patients. You will have preclinical lab hours, whereas in third year and final year you will have clinical postings. Now moving on to the subjects, you will have to study 19 subjects during the course of your BDS, out of which 11 are dental subjects and 8 are medical subjects. During the first 3 years, you will have only 1 dental subject per year, and in the final year, you will have 8 exclusive dental subjects. Now, talking about the examinations, you will have exams, theory exams and practical exams at the end of each year. You will have to pass these exams with a minimum of 50% marks to get promoted to the next year. The next important thing you need to know about BDS is there is something called quota completion. As I told you, you will have preclinical lab hours during your preclinical years and clinical postings during your clinical years. In both these cases, you will be assigned to do a certain number of tasks within a limited number of time. You have to complete your quota. Only if you complete your quota, you will be allowed to write your university exam at the end of the year. To brief you about quota, I'll just tell a small example. There is a department called prosthodontics where you will be having preclinical works during your first year and second year, and you will be posted in the department to do the patient work during the third year and final year. Say for example, in second year, you will be asked to do 10 complete dentures during the course of your second year. This will be the quota for your preclinical prosthodontic lab work in second year. In third year, when you start working on patients, you will be asked to do some 5 or 10 removable partial dentures for patients. This will be the quota for your third year. This is pretty much what quota is all about. So you will have to complete quotas that is given from all the departments. You will have to finish those quotas. Only then you will be allowed to write your university examination. Moving on to the next important topic on how to choose the right college. This is very important because you will never know which college you are going to get into until and unless you're there in that moment inside the counseling hall. So it is very important for you to gather information about every college that is present in your state. Now I'll be telling you some few tips and tricks on how to choose the right college or how to get into the right college. The first and the most important thing is you should know about the patient flow of the college that you are going to get into. As a medical student, it is very important to get a good patient exposure, and as a dental student, it is very important to get patient exposure because you will have to complete your quota. In order to complete your quota, your college should have a good number of patient flow. If it's not going to be there, it is going to be very difficult for you to complete your quota and you will not have proper clinical exposure. The second important thing is the location of the college, which again is related to the patient exposure, because if your college is located In the city, it is going to be a residential area, so you can expect a higher patient flow when compared to the colleges that are located on the outskirts of the city. It is important to choose a college which has good facilities and a good faculty. One important point to look into when choosing a college is the fees. Some colleges might charge you a lesser fees when compared to the others, but they might ask you to get the books, instruments and materials all by yourself. Trust me guys, dental books, materials and instruments are all costly. You cannot go buying them on a regular basis, or you cannot keep going and getting them every now and then. It is better if your college provides you with all these things. The fifth important thing would be hostel. If you're going to be a hostler, that's where you're going to spend the next 5 years of your life. So it is important to choose a college which has a good hostel, and before joining the college, make sure you visit a hostel, check the rooms, the bathrooms, the toilets and the mess. And the next important thing for day scholars would be transportation. Not every college will have transport facilities. Pretty much everything that I wanted to tell you guys before choosing the right college. Now moving on to the next topic, how to know if this is the right course for you. I will tell you the reality of what happens in a dental school and what I faced as a dental student. You will have a hell lot of practical work to do and complete within the given deadline. That is the quota. You will have to complete the quota. Simultaneously, you will have theory exams going on in your college. You will have to study for those exams. You will have assignments. You will have paper presentations, this and that to do. You should be able to manage your time properly. Time management is very important, and you should have the willpower and the capacity to tolerate all this stress. And the next important thing is, as I told you, is not every college will have a good patient flow. So in order to complete your quota, sometimes there might be a chance where you will have to go get your patients. In order to get patients, you will have to pay for them, or you will have to wait for them, and these stuffs are going to happen. So you will have to be prepared to face anything and everything that comes in your way. And the other important thing is, as I told you, you will have assignments, record works, observation works to do and complete within the given deadline. And again, time management is very important. Dentistry is an expensive course, and you will always need to have a backup amount just in case you lose an instrument, or just in case you have to get the materials. You should always have a backup amount of few thousands. Unga college ungalku vande instruments ella kuduthalum, they are only going to give it to you for the first time. The next time if you lose it, or if it's going to be over, you will have to put your own money to get those instruments. So it is always better to have a backup amount. The next important thing is, do not have PDS as a backup option. I've seen a lot of people choosing PDS, a lot of my classmates, a lot of my seniors choosing PDS just because they couldn't get into a medical school, just because they want to be called a doctor. Please don't do that if you don't know anything about this course. That is the main purpose of this video. This is to let you know about PDS. Let me tell you my personal experience on how I got into PDS. I was someone who never wanted to study PDS. PDS was just like, ew, I'm not going to look into other people's mouth, but look where I am today. Right from my childhood, my parents have always told me that they wanted to see me as a doctor studying MBBS. I too wanted the same thing till 10th grade, but as soon as I stepped into 11th grade, MBBS was just like, I just didn't want that. I didn't want that. So I was just enjoying my 11th and 12th grade, but when NEET exams were coming up, I started to prepare for those exams. And when I came out of the hall, I thought I did pretty well. And Akash and Alan, all those institutes used to release the answer keys the very next day, and I checked those answers. I was cross-checking and I got the marks. It was a pretty decent mark. I thought even if I don't get into a government college, I will get into a self-financing college through government quota. Results varadhukku oru varam munnadi, what they do is they upload the scanned copy of our OMR sheet. That is when I realized that I have marked the answers correctly on my question paper, but while shading it on the OMR sheet, I have made mistakes. I have jumbled up the answers, and I was like heartbroken, because there's going to be negative marking and there is going to be a loss of marks, and I was completely devastated because I did not apply into any other colleges. Idhula kedikkonda nambikilla na vera endha college kume apply pannave illa, and we didn't know what to do, and it was such a hectic time. Adukapra ennachu, there is a women's Christian arts college in my city. What my parents asked me to do was to go study there. That is another worst case scenario which I've ever imagined. I never thought I'd be studying there. But they asked me to go because they asked me if I wanted to repeat. I said no, because I cannot imagine studying physics and chemistry for another year. I said no. So they put me in this college. They asked me to go to the college till 1:30, because arts college work was only till 1:30 or 1 o'clock, I don't remember. And they asked me to go to college from morning till 1:30, and after that I have to go for NEET preparation, NEET classes. I was like, oh my god. But I had no other option. I did those things for the 2 months, but I used to keep checking the website every day, the Tamil Nadu counseling list website, to see if there is any vacancy and stuff, but nothing came up for For 2 months, this was my routine: go to this college, attend Neet classes in the evening, come home, cry like shit. Oh my god, I cannot even imagine that. But then after 2 months, they started the BDS counseling, and that's how I got into BDS. I just wanted to get the hell out of this college. So this was my only gateway, and I was like, it's okay, நான் BDS படிக்கிறேன் பரவாயில்ல அப்படின்னு சொல்லிட்டு I joined BDS, and trust me, now I'm enjoying every bit of it. And I think this is the best choice that I've ever made. So you will never know how it is going to treat you until and unless you're there in that situation. But I hope this video helps you. Okay, now moving on to the next thing, options after BDS. There are so many options after BDS, you guys. You can do MDS. After doing your MDS, you can start your own clinic or work in a hospital, or you can work in a college as a professor, or there are so many diploma courses now available for 6 months, 1 year, 2 year. You can study those diploma courses to get specialized in a particular department. And the next thing is you can work in a NGO, or you can join army. The options are wide. It is up to you to choose what you want to do. And now moving on to the next thing, scope after BDS. This is something that I get asked a lot. Scope irka? Can you earn a lot of money after studying BDS and stuff? See, every field is oversaturated. I'm not saying saturated, it's oversaturated. But if you have the talent, if you have the hard work, if you have good marketing strategy, and if you are going to talk to patients in the most pleasing way and give them the best treatments, they are going to come to you no matter what. On the other hand, even if you've studied MDS, PhD and stuff, you have the fanciest clinic in the city, but you don't give proper treatment, people are not going to come to you. So what makes you stand out is your hard work, your talent, and the way you treat patients. So scope and பார்த்தா எல்லாத்துக்குமே ஸ்கோப் இருக்கு. ஆனா அந்த ஸ்கோப்பை உருவாக்கிக்கிறோமா இல்லையா அப்படிங்கிறது நம்மளோட கையில தான் இருக்கு. So all the best to all the students who are planning to join BDS, and all the students who are going to write the NEET exam this year. All the best. Take care. Stay safe. Bye. And if you haven't subscribed to my channel yet, please take a moment to subscribe.